Welcome students to our new YouTube channel Pharma X Tech, the division of excellence. So let's start to the new chapter which is anti-epileptic drugs. So in anti-epileptic drugs we will see the what is epilepsy. So the epilepsy refers to a disorder of brain function characterized by the periodic and unpredictable occurrence of seizures, and these seizures develop when the balance between excitatory and inhibitory mechanisms is disturbed at the cellular or the synaptic levels, and a sustained depolarization of the membrane with a burst of action potentials arise in the epilepsy, which are Na plus, that means sodium dependent at their onset, and Ca2 plus, that means calcium dependent at the end. And during the seizures of almost all types of seizures, the extracellular concentration of Ca2 plus drops significantly, and also the extracellular K plus, that means potassium K plus, arises after a brief delay in comparison with the drop in Ca2 plus, and the extracellular Na plus falls moderately with a smaller rise in extracellular chloride. So next we will see the neurotransmitter imbalance, and in neurotransmitter imbalance at the synaptic level there is an imbalance between the excitatory neurotransmitters like glutamate and inhibitory ones like gamma aminobutyric acid, that means GABA, and also glycine, and this may explain the heterogeneity of seizures, and also the solitary lesions of neurocystic cirrhosis are an important cause of epilepsy in India. So this neurocystic cirrhosis is the most important cause of epilepsy in India. So this is most important question in GPAT. That means which is the most important cause of epilepsy in India, and the right answer is neurocystic cirrhosis. Next is the epileptic seizures have been classified into partial seizures which begin focally in a cortical site, and generalized seizures which involve both hemispheres widely from the outsets. So next we will see the various types of these seizures and their features and conventional anti-seizures drugs. So in pathophysiology also question asks about seizures, that means types of seizures, and in pharmacology the drugs, anti-seizure drugs are asked. So the first type is partial seizures. In that first one is simple partial, and the features of this simple partial is the consciousness is not lost in the simple partial seizure, and jerking of one hand or twitching of one half of the face is also the feature of this simple partial seizure, and also the spikes pattern in ECG, that means electrocardiography. And the conventional anti-seizures drugs in simple partial seizures are carbamazepine, phenytoin, valproate, gabapentine, lamotrigine, tiakabin, that means tiakabin, and topiramate are the conventional anti-seizures drugs for simple partial seizure. So the next seizure type is complex partial seizures, and the features of these complex partial seizures are motionless stare with altered consciousness with automatism. So next seizure type of seizure is partial seizures evolving into secondarily generalized seizures, and the features of this is tonic clonic seizure with loss of consciousness and sustained contraction, tonic of muscles throughout the body followed by periods of muscle contraction alternating with periods of relaxation, that means clonic, and typically lasting 1 to 2 minutes. So next we will see the generalized seizures, and there are 4 types of these generalized seizures like absence seizure, and the feature of this is the sudden and momentary lapses of awareness with staring and rhythmic blinking occurs in children lasting less than 30 seconds, and the drugs is used in absence seizure is valproate. So next is myoclonic seizures, and the feature of this myoclonic seizures is a brief, that means perhaps a second, shock like contraction of muscles which may be restricted to part of one extremity or may be generalized, and the anti-seizure drugs for these myoclonic seizures is also valproate, lamotrigine and topiramate. So the next generalized seizure is, third one is tonic clonic seizures, and the features of this tonic clonic seizures is the abrupt loss of consciousness with tonic extension of all four limbs and the trunk, and followed by synchronous clonic muscles jerking less than 90 seconds, and the conventional anti-seizure drugs for these tonic clonic seizures are carbamazepine, phenytoin, phenobarbital and valproate. So the last generalized seizure is atonic seizures, and the feature of this atonic seizure is sudden loss of muscle tone in the whole body, usually resulting in a fall and severe injury, and these conventional anti-seizure drugs for these atonic seizures are valproate, clonazepam and clobazepam. And also the increase inhibitory tone by facilitation of GABA mediated hyperpolarization. Examples are barbiturates and benzodiazepines, and the decrease axonal conduction by preventing Na plus influx, that means sodium influx through fast Na sodium channels, and the examples are carbamazepine, phenytoin, and also the at high doses barbiturates and valproic acid, and in the presynaptic Ca2 plus, that means calcium influx through type T channels in thalamic neurons, ethosuximide and valproic acid, and also the excitatory effects of glutamic acid, lamotrigine, topiramate blocks the AMPA receptors, felbamate, and this felbamate blocks the NMDA receptors. So next we will see the anti-epileptic drugs and their mechanism of action and also their adverse effects. So the first drug is barbiturates, and in barbiturates there are phenobarbital and pyrimidone, and the mechanism of action of these barbiturates are the mimic action on GABA. Pyrimidone is prodrug, and in the liver it converts into phenobarbital and phenylethyl malonamide, that means PEMA, and the adverse effect of these barbiturates are like sedative hypnotics. So next is benzodiazepines like diazepam, clonazepam and clobazam, and the mechanism of action of these benzodiazepines are the facilitation of GABA, that means gamma aminobutyric acid, and third drug is hydantoin, in that the phenytoin and phosphenytoin, and the mechanism of action in this, there is decreased axonal conduction by preventing Na plus influx through voltage sensitive Na channels, and the next drug is immunostilbene, and in this immunostilbene there is two drugs like carbamazepine and oxcarbamazepine, and the mechanism of action of these immunostilbenes are it resembles with phenytoin, and the adverse effects of these immunostilbenes, that means carbamazepine and oxcarbamazepines, are neurotoxicity, vertigo, diplopia and ataxia, and also teratogenic effects like neural defects. So the next drug is succinamide, and the example is etosuxinamide, and the mechanism of action of this succinamide is there is a decrease in presynaptic Ca2 plus influx through type T channels in thalamic neurons, and the adverse effects of this succinamide is gastrointestinal intolerance. So the next drug is carboxylic acid, and the examples are valproic acid and divalproex, and the actions mechanism of action of these carboxylic acids are there is Na plus channel inactivation and also the decrease in level of presynaptic Ca2 plus influx through the type T channels in thalamic neurons. And the adverse effect of these carboxylic acids are anorexia, vomiting. This vomiting is common adverse effect of this carboxylic acid, like examples valproic acid, and also alopecia and thrombocytopenia, fulminant hepatitis. This is serious adverse effect of carboxylic acid, fulminant hepatitis, and also spinal bifida and neural tube defects in fetus. And also next drug is phenyltrazine, and the example is lamotrigine, and the mechanism of action of this phenyltrazine is there is a decrease in axonal conduction by preventing Na plus influx through voltage sensitive Na channels, prolonged inactivation of Na channels. And the adverse effect of this phenyltrazine, that means lamotrigine, is diplopia. So the next is Gaba Analogues, and these Gaba Analogues example is Gabapentine, and the mechanism of action of this Gaba analog Gabapentine is facilitation of GABA A mediated channel openings, and this is first line drugs in the CPS and pain due to diabetic neuropathy. So this Gabapentine is the first line drug in the CPS and pain due to diabetic neuropathy. So most important question for GPAT: which first line drug used in CPS and pain due to diabetic neuropathy? And the right answer is Gabapentine. And the adverse effect of this Gabapentine, Gaba analog, is sedation and dizziness. And next we will see the most important is the newer drugs of these anti-epileptics, and the newer drugs are Tiakabin, and the mechanism of action of this Tiakabin is it blocks GABA transporters, and the adverse effect of this Tiakabin is mild sedation and nervousness. And the next drug is topiramate, and its mechanism of action of the topiramate is it blocks glutamate AMPA receptors and increases the GABA effects. And the third drug is vigabatrin, and the mechanism of action of this vigabatrin is it inhibits GABA transaminase and also it prevents the degradation of GABA. So the last newer drug is zonisamide, and the mechanism of action of this zonisamide is it prolongs inactivation of sodium channels, that means Na channels. Next is phenytoin. The phenytoin, it is hydantoin derivative, and action is given by blocking the axonal sodium channels, that means Na channels, that gives membrane stabilizing action. So in GPAT there is a question which is the derivative of hydantoin, and the right answer is phenytoin. And also reverse question is asked phenytoin is which derivative, and the right answer is hydantoin, because phenytoin it is a hydantoin derivative. So next we will see the adverse effects of this phenytoin, that means it is hydantoin derivative. The adverse effects of these phenytoins are gum hypertrophy, the gum hypertrophy, hirsutism, megaloblastic anemia, and osteomaltia are the adverse effects of phenytoin. So in GPAT there is a question, what is the adverse effects of this phenytoin, and the right answers are gum hypertrophy, hirsutism, megaloblastic anemia, and osteomaltia. And also the teratogenic effects as hydantoin syndrome, synaptic cleft, hair lip, and microcephaly due to toxic metabolite arenoxide, that means iron oxide. And also the adverse effects are fall in blood pressure and arrhythmia in only one, that means administration of phenytoin. So if you administered phenytoin, there is adverse effects like fall in blood pressure and arrhythmia. So next we will see the some interactions of phenytoin. The phenytoin acts as enzyme inducer and it induces metabolism or degradation of many drugs. And the examples are steroids, that means failure of oral contraceptives, and also digitoxin, doxycycline and theophylline. And the valproate displaces protein bound phenytoin, that means phenytoin toxicity. That means also the valproate displaces protein bound phenytoin, it gives the effects like phenytoin toxicity. So next we will see the whole classification of anti-epileptic drugs. So in that, first hydantoins, in that the examples of hydantoins are phenytoin and mephenytoin. Then second one is barbiturates, and the example of barbiturates are phenobarbital, mephobarbital and primidone. So next is immunostimulants, and the examples are carbamazepine and the next one is succinamides, and the examples are ethosuxinamide and phensuxinamide. And the next one is benzodiazepines, and the example of benzodiazepines are clonazepam, diazepam and clobazam. Then oxazolidinones, and the examples of these oxazolidinones are trimethadione, paramethadione and ethadione. So in oxazolidones, examples are trimethadione, paramethadione and ethadione. So the next one is sodium valproic acid, and the newer anti-epileptic drugs, they are progabide, vigabatrin and gabapentine and lamotrigine. These are whole classification of anti-epileptic drugs. In that we see the hydantoins, barbiturates, immunostimulants, succinamides, benzodiazepines, oxazolidinones and newer anti-epileptic drugs. So next we will see the epilepsies and their drug of first choice. So in that the first one is generalized tonic-clonic seizure, and the first drug of choice in generalized tonic-clonic seizure is carbamazepine and phenytoin. This tonic-clonic seizure is also known as grand mal epilepsy, and phenytoin is the first choice in grand mal epilepsy. So next is absence seizures. This absence seizures is also known as petit mal epilepsy. So the first drug of choice in absence seizure is ethosuxinamide, and alternate drug is valproate. So the next is temporal lobe epilepsy, is also known as uncinate fit, and the drug of choice in temporal lobe epilepsy is carbamazepine. So the next one is trigeminal neuralgia, and the first drug of choice in trigeminal neuralgia is carbamazepine. So the next one is akinetic seizures. The first drug of choice in akinetic seizures is sodium valproate. Then next one is myoclonic seizures. The first drug of choice in myoclonic seizures is sodium valproate, and the alternative drug used it is clonazepam. So the next one is febrile seizures, and the first drug of choice in febrile seizures is rectal diazepam. The next one is status epilepticus. The first drug of choice in status epilepticus is intravenous diazepam. So next one is infantile spasm, also known as hyperarrhythmia, ACTH or corticosteroids. So this infantile spasm, the first drug of choice is ACTH or corticosteroids. So the next one is psychomotor seizures, also known as complex partial seizures. So the first drug of choice in psychomotor seizures, that means complex partial seizures, is carbamazepine. So next we will see the mechanism of action of all anti-epileptic drugs. So in that we first see the facilitation on GABA mediated chlorine channel opening, and the drugs are barbiturates and benzodiazepines, valproate, Gabapentine and Gabapentine. And the next one is prolongation of Na plus channel inactivation, and the drugs are Phenytoin, Carbamazepine, valproate, lamotrigine. Then next one is inhibition of T-type calcium 2 plus, that means Ca2 plus current. They are ethosuximide, trimethadione and valproate. So these ethosuxinamide, trimethadione and valproate are the drugs for inhibition of T-type Ca2 plus current, and they are currently used drug in inhibition of T-type cells. So the next one is Phenytoin. It is oldest non-sedative anti-epileptic drugs used is Phenytoin. So in GPAT there is a question, which is oldest non-sedative anti-epileptic drug used. So the right answer is Phenytoin. So next we see the uses of this Phenytoin. The first use is in grand mal epilepsy. The drug of choice is Phenytoin. So in GPAT there is a question, drug of choice of grand mal epilepsy, and the right answer is Phenytoin, because the Phenytoin is first drug of choice in grand mal epilepsy. So next use is digitalis induced cardiac arrhythmias. The drug of choice is lignocaine. Also the same question again, which is drug of choice in digitalis induced cardiac arrhythmia, and the right answer is lignocaine. So the next one is trigeminal neuralgia, and the drug of choice is carbamazepine. And next one is status epilepticus, and the drug of choice is intravenous diazepam. So these are most important drug of choice in GPAT. So there is question for drug of choice every year. So the next we see the adverse effects of this Phenytoin. The first adverse effect is gum hyperplasia. This gum hyperplasia is the commonest adverse effect of this Phenytoin. So next we see the drugs causing gum hyperplasia, and they are Phenytoin, nifedipine. This nifedipine is calcium channel blocker, and also oral contraceptives, cyclosporins. And the second one is hirsutism and hypertrichosis. So next we see the drugs causing hypertrichosis, and they are Phenytoin, cyclosporin A, diazoxide, and phenothiazine, minoxidil, and hexachlorobenzene. So these are drugs causing hypertrichosis include Phenytoin, cyclosporin A, diazoxide, phenothiazine, minoxidil, and hexachlorobenzene. So the next we see the megaloblastic anemia. This is due to folic acid deficiency. So there is a question in GPAT, which causes megaloblastic anemia, and the cause is due to folic acid deficiency. So the next one is lymphadenopathy. So this lymphadenopathy, this is also adverse effect of this Phenytoin. So next we see the drugs causing lymphadenopathy. So the drugs causing lymphadenopathies, they are phenytoins and primidone. So in GPAT there is a question, which are the drugs causing lymphadenopathy, and the drugs are phenytoin and primidone. And next one is osteomaltia, and the drug causing this osteomaltia are phenytoin, heparin, corticosteroids, and GnRH analogues. So gonadotropin releasing hormones analogues are the drugs causing osteomaltia. These osteomaltia drugs causing osteomaltia includes phenytoin, heparin, corticosteroids, and GnRH analogues. So these corticosteroids, heparin, GnRH analogues, phenytoins, these are drugs causing osteomaltia. So next we will see the systemic lupus erythrometers. These are also adverse effect of this phenytoin. So the next we will see the drugs causing systemic lupus erythrometers, and the drugs causing this SLER, hydralazine, procainamide, penicillamine, asbutolol, isoniazide, phenytoin and practolol. So these are drugs causing systemic lupus erythematosus, and they are hydralazine, isoniazide, procainamide, penicillamine, asbutolol, phenytoin and practolol. So the next adverse effect is hyperglycemia, and various causes of this hypercalcemia included. First one is hormones countering the effect of insulin, in that catecholamines inhibit insulin release, and glucagon, also calcium growth hormone, glucocorticoids and thyroid hormones and somatostatins. These somatostatins inhibits the insulin release. So the next cause is drugs inhibiting insulin release, and the drug inhibiting insulin release, they are phenytoin, phenblastin, diazoxide, thiazide and colchicine. So these are drugs inhibiting insulin release. They are phenytoin, colchicine, thiazide, phenblastin and diazoxide. So the last one is drugs causing hypoglycemia, and the drugs causing hypoglycemia are insulin, oral hypoglycemic drugs and quinine, and also the cerebellar and vestibular manifestation, ataxia and vertigo. So in this way, there is end of this chapter, anti-epileptic drugs. In that we have seen the classification of these anti-epileptic drugs, and also various and also the basic information about epilepsy and various types of seizures. They are partial seizure, tonic clonic seizures, simple seizures, grand mal epilepsy, atonic seizures. So and also various drugs and their adverse effects we have seen in this chapter. So hope you understand this all anti-epileptic drugs and their drug of choice, and also mechanism of action of these anti-epileptic drugs. And there are various drug of choice in this chapter. So most important chapter for GPAT is anti-epilepsy drugs. So the drug of choice is asked from this chapter, and so this is most important. So hope you like this video. Please, if you like this video, please comment on comment section, and if you any doubt of this chapter, then also comment on this comment section. So please share this video to more and more to your GPAT aspirants as well as CET aspirants and competitive exam preparation aspirants. So also like, share and subscribe to our channel. And thanks for watching this video. Thank you for watching this video, and stay tuned in Pharma X-Tech. So thank you. Stay tuned. Stay connected with Pharma X-Tech. Thank you. Welcome students to our new YouTube channel Pharma X-Tech, the division of excellence. So let's start to the new chapter, which is anti-epileptic drugs. So in anti-epileptic drugs,